Bismillahirrahmanirrahim. As we're discussing drowning, and this is the seventh lecture of this series. And today I'll be discussing the internal autopsy findings. And the internal appearance or the internal autopsy finding, they are that there may be asphyxial changes in the body. And there are certain characteristic features which confirm that the death is due to drowning only. And those characteristic features which are seen in drowning, they are water in the middle ear, changes in the respiratory tract, and certain biochemical changes in the blood. Then the presence and the characters of water in stomach and intestine. Then the presence of diatoms in the tissues and certain other signs which are indicative of death due to drowning. So these are internal signs which are pathognomonic that the death is due to drowning. So regarding the water in the middle ear, this is found in the middle ear due to the violent respiratory efforts. Then the changes which appear in the respiratory tract, the lungs, they show the best evidence of drowning. The changes which it shows is the edema aqueous, that is the sign of being waterlogged. So edema aqueous is basically the term used to describe the hyperextended and waterlogged lungs. So expanded. Normally the medial margin of the lungs, they do not coincide with each other. There is gap because of hyperinflation and waterlogging. They expand and their middle margins, they meet in the midline. And when you remove on the body, they do not collapse. They remain inflated. Then the petechial hemorrhage, they are seldom seen because the blood vessels, they are compressed due to water-filled alveoli. The respiratory passages usually contain fine white froth, and sometimes this froth is blood-stained and may also contain foreign materials such as the algae, the weeds, the mud, and the sand. Now, as soon as the putrefaction sets in, this important sign is lost as the fluid transutes from the lungs into the blood. Then the edema aqueous or the emphysema aqueous, expanded lungs which cover the mediastinum and the ribs. And it is more commonly seen in salt water drowning than in freshwater drowning, where the water is rapidly absorbed in the body. However, there is no significant difference in the weight of the lungs in both salt and freshwater. At autopsy, it is mostly observed that they are waterlogged, voluminous, and bulge out of the chest wall when the sternum is removed. Overexpanded lungs, you can see like this. They show impression of the ribs on them because of being voluminous and being compressed against the internal surface of the ribs. So you can see the rib markings on the lungs. Then this is an important sign, the Poltoff spots. These are basically subpleural hemorrhages, and in 50 to 60% of cases of drowning, they reflect the intra-alveolar hemorrhages, and they are called Poltoff spots. Now regarding the biochemical changes. In typical drowning, whether it is fresh water or salt water, the circulation is usually maintained for some time after the lungs are filled with water. Then the exchange of water and electrolytes will occur between the blood in the lung capillaries and the water in the lung spaces till an equilibrium is established. So these exchange of water and electrolytes will cause the biochemical changes which are diagnostic for the drowning. In freshwater drowning, what happens is, since it is hypotonic, when the water enters into the blood, it enters into the circulation and there is hemodilation. And this causes the RBCs to burst open because of the hypotonicity. And there is liberation of the release of the potassium, and which is responsible ventricular fibrillation, and that is the cause of death. So after the water entering the pulmonary circulation, it first reaches to the left side of the heart. And the chloride content of the left side of the heart are therefore diminished. So in freshwater drowning, the chloride content on the left side of the heart will be lower side. Now what happens in saltwater drowning? In saltwater drowning, all these changes are reversed because this is hypertonic water and it will extract water from the circulation into the lungs. And there will be hemoconcentration, RBCs will be crenated, and the chloride content of the left side of the heart will be increased. Magnesium is in the seawater and it will be increased on the left side of the heart, magnesium. So the water cannot reach the left side of the heart if the dead body is thrown into the water. It will only be reaching to the left side of the heart when the person is alive and he drowns, he is engulfing water and the circulation is patent. Now, water in the stomach and in intestine, the stomach contains water which has swallowed during the struggle for life. And this may be salty or the fresh, clean or dirty, whatever the medium is. And they may even contain algae, the weeds, the mud and the sand. And this is an important evidence provided the victim had not drunk this water immediately before drowning or submersion. So this water by the peristaltic movement may enter into the small intestine, and it is the absolute proof of death due to drowning. But if the dead body is thrown into the water, it is not possible for water to go beyond the cardiac sphincter. So when the putrefaction sets in, these sphincters are relaxed and the content may go beyond. So thank you very much. This is all.